Hi, I'm Dr. Christian Subio, a board-certified plastic surgeon in Newtown Square in the suburbs of Philadelphia. Today's video is about the difference between tummy tuck and liposuction and which may be right for you. A lot of patients are interested in liposuction because they view it as a less invasive, less costly alternative to a tummy tuck. But that's not the full story. If you look at the abdomen on the left compared to the right, it's not just fat on the outside which is changing that shape. If you look a bit closer, you'll see that the abdomen is made of 4 layers. Fat on the inside, the muscle layer, fat on the outside, and then the skin. And unless you address all 4 layers, you may not get the result you're looking for. First, let's talk about the fat on the inside. This is the fat that the plastic surgeon can't address. The only way to address this fat is via diet and exercise, or with a weight loss procedure such as gastric banding. If I have a patient who has a tremendous amount of this intra-abdominal fat, I tell them that the result could be limited. Next, we have the muscle girdle. That's the layer that's holding everything in. As you see on the left picture, in youth it is firm and tight. But in the middle picture you see if you gain weight or become pregnant, it's going to stretch all that out. And even if you lose the weight or have the child, in that third picture you see that those layers never really contract down. It's going to stay a little bit loose, affecting the shape. The only way, even with diet and exercise, it won't happen. The only way to affect it is with a tummy tuck procedure, whereby I have access to those muscles and I can sew them back together, making everything firm and tight again. Next, we have the fat on the outside. This is the fat that you can actually grab. On the picture on the left, you see someone with a small pocket of fat. This is great for liposuction because you can suction that and the skin will then shrink down onto the abdominal wall. In the center picture, you see someone who has an excess amount of that fat. That's not a great candidate for liposuction because if you suction that out, it's going to deflate the area and lead to the picture on the right side where the skin is flabby and excessive. Which brings us to the final layer, the skin on the outside. On the left-hand picture, you see that flabby, excess, loose skin. It's true there do exist lasers and devices which can shrink that skin somewhat, but only to a very small degree, not to a significant degree. The only way to affect drastic changes is via tummy tuck, whereby we make an incision below the belt line, we lift that skin, we pull it down and trim away all that excess, and then suture it down, leaving the scar beneath the belt line. We bring the belly button out through its new position, and with this powerful maneuver, we can really tighten things well. So in the end, you have liposuction, which is good for small pockets of discrete fat for contouring and sculpting. And then you have tummy tuck, which is more powerful because we can add liposuction, we can take those muscles and suture them back together and tighten from the inside. We can take a tremendous amount of skin and fat and remove it completely and suture it together, making everything tight. And in the end, give you a much more dramatic result. Which procedure is right for you depends upon your anatomy and can only be determined by an exam with a board-certified plastic surgeon. It is important to see a board-certified plastic surgeon for this, because if you see a cosmetic physician or cosmetic surgeon not board-certified by the American Board of Plastic Surgery, they might not be able to do a tummy tuck. And then you're not going to get all your options, and you may be walking away with a procedure that's not right for you and leaving you less than happy. So I hope this video has been educational for you, and if you have any questions, feel free to call, but otherwise, thanks for watching.